The year 2003 is a very significant year for chai as we celebrate the Diamond Jubilee of chai. It also gives us an opportunity to take a look at the effort that chai has made to bring health and healing to the people of India. It was the dream of Sister Mary Glory, especially after the Second World War, to take care of a nation that was ravaged by the war, especially when there was practically no infrastructure and health professionals were scarce after the Second World War. And so keeping this in mind, she took the initiative along with other 16 religious sisters of different congregations and gave birth to chai to take care of the health and healing ministry of the church in India.
Though rich in resources, the people of India were affected by several factors, including colonization. The health situation of the people was very poor, especially that of women and children. Infant mortality rate was very high among the poor in the rural areas. Epidemics and famines took a heavy toll. Medical services, particularly for the majority of the population in the rural areas, were scarce. In February 1920, an Australian-born young doctor, Mary Glory, reached Guntur railway station in Andhra Pradesh. She experienced what every pioneer missionary suffered in India, heat and drought. She joined the Society of Jesus, Mary and Joseph. She worked in the dispensary and studied Telugu in order to speak with the patients. Patients of all kinds come, but there is one class which is coming in even greater numbers, the childless mother. We received women who had lost 3, 6, 8 and even 13 babies, she wrote to one of her sisters. There was so much work to be done and so many patients. I could work day and night without stopping, said Sister Mary. During the first 10 years of the beginning of St. Joseph's Hospital in 1927 in Guntur, she cared for 6,37,096 patients. She spoke in a World Congress. There is only one medical woman available for every 17,000 deliveries, to say nothing of the various other illnesses and stresses to which the Indian woman is subjected to. Indian women require the services of medical women. We hope to see a medical college for women established in South India. We need to multiply our hands to meet the ever-growing health challenges of India, she cried. Most people live constantly on the borderline of starvation, she wrote to people back home. The sisters of the Catholic Church had been already working among the poor in remote parts of the country, offering medical help, but with hardships. Sister Mary began writing to bishops and sisters. Union gives strength. An appeal to Catholic hospitals in India to organize and form a Catholic Hospitals Association. She dreamt, planned and gave a call to sisters to consolidate all the earlier efforts to form an association. 1943. The world was at war. It was a year of great medical need. Neither hospitals nor professional staff were adequate to care for the wounded. Such was the occasion of the birth of the Catholic Hospital Association on the Thursday, July 29, 1943, with 16 sisters at St. Joseph's Hospital, Guntur, Andhra Pradesh. An association which was actually born out of nothing, in the words of founders. The far-sighted resolutions of the first meeting were to establish a Catholic medical college and a collegiate course in nursing, to publish a pamphlet or magazine, and to appoint a board of examiners in nursing and midwifery. The association continued to grow as the number of church-related medical and health institutions increased in the country. Sister Glowry, after serving the association for nearly 14 years as its president and the first vice president, wanted to pass the mantle to a suitable person to lead the association. 1957. Father James S. Tong was appointed in 1957 as the first full-time executive director of the association. Father Tong travelled the length and breadth of the country and brought to the association the knowledge of the country, the church and the people, the religious and laity. Wherever I have gone, fresh interest has been aroused, said Father Tong. The association had reached around 100 hospitals by then. During the second decade of the association, emphasis was given to providing continuing education inputs to its members through the journal, annual conventions, seminars, and providing assistance to members to meet their needs for medicines and equipment, recognizing the importance of public health, and to reach out to the community. For 17 years, Father Tong relentlessly worked for the association. Catholic Health Association became the recognized organization for submitting and approving applications for aid for Catholic institutions from donor agencies abroad. 1963. The dream of Sister Mary Glowry of establishing a Catholic medical college came true in 1963, 6 years after her death in 1957. St. John Medical College and Hospital began functioning in Bangalore. 1968. Chai completed 25 years. The celebrations held in Delhi proved the energy and enthusiasm of the members for a long journey ahead. 1974. Father Emmanuel Palikunel became the director of the association in 1974. His contribution towards promoting the central purchasing service was highly appreciated. 1978. The journey was on. Continuous reflection on the reality and its interventions, the Catholic Health Association set new priorities during the fourth decade of its existence to improve the standards of hospitals and dispensaries in India, to promote, realize and safeguard progressively higher ideals in spiritual, moral, medical, nursing, educational, social and all other phases of health endeavor, to promote community health and family welfare programs, to assist voluntary health organizations in procuring quality amenities. Father John Vattamatam assumed the office of the director after Father Morris being the director for a brief period of 12 months. 1980. The present phase began in 1980. The phase that saw many changes in the association. In 1986, Chai shifted its office from CBCI Delhi to a much spacious place in Secunderabad. The association grew up with more number of full-time staff. The Medical Service Journal was transformed into Health Action. Health Accessories for All, a publication wing of Chai, was established. Seeking the signs of the time, Chai adopted for itself the goal of health for many more, a modification of the Alma Ata goal of health for all by 2000 AD, with a special emphasis and focus on the poor. 1983. A community health department was developed with an understanding of the concept of community health as a process of enabling people to exercise collectively their responsibilities to maintain their health and to demand health as their right. In 1983, Chai chalked out a 10-point program for the next decade. Promotion of community health programs, promotion of spiritual and pastoral aspects of health care, promotion of respect for life, working towards self-sufficiency, building up of solidarity among our members, strengthening diocesan and regional level organization of chai, membership drive, promotion of low-cost medical care, promotion of indigenous medicines and holistic approach to health and training new types of healthcare personnel, 1993. The year of Golden Jubilee, Chai came forward to have a self-evaluation of the past 50 years. It was a meaningful gesture, indeed, on the eve of the Golden Jubilee. The evaluation enabled Chai to understand its strengths, weaknesses, opportunities and threats. Moving towards the direction of self-sufficiency, a training center at Medchal, close to Secunderabad, was established with training facilities and a herbal garden. It was in 1995 the Catholic Hospital Association of India became the Catholic Health Association of India. Father John handed over the directorship to Father James Koulas in 1995, the position which he held for nearly 16 years. 1995, the phase of decentralization.
As you understand, India is a subcontinent and the membership had soared up to over 3,000. And we felt for effective and efficient functioning of chai need to decentralize, and the comprehensive plans targeted on building up and strengthening the membership and making them much more viable in the health field to function. We have set up regional units, we have strengthened them, we had several programs through which we have enabled the regional units to function much more effectively and efficiently. We have also formed over 126 diocesan units with its own staff, with its own capacities and capabilities to function effectively and bring health and healing to the underprivileged of this country.
The regional activities are coordinated well by the central office with liaison officers for each region. Regular national consultation of regional units became avenues for sharing rich experiences from the regions, exchanging resources, evaluating various initiatives, and to evolve new strategies for future interventions. The 11 regions Catholic Health Association of Andhra Pradesh, Bihar, Madhya Pradesh, Tamil Nadu, Western Region, Northeast, Rajasthan, Uttar Pradesh, West Bengal, Kerala and Karnataka. 2000. Father Sebastian Auseparampil was invited to be the director in 2000 to lead the association into the new millennium. The vision and the mission statements were further sharpened and gained focus. Today, Chai reaffirms its views on health as a state of complete physical, mental, social and spiritual well-being, and not merely the absence of sickness.
There are two fronts on which Chai is looking forward and focusing its attention and its resources. One is, as we all understand, communicable disease, especially HIV/AIDS, TB and malaria has come back with a vengeance. All of us are aware that HIV/AIDS has become a major challenge to the health of the people of this country and globally. And so Chai takes these two frontal problems of health as its focus and plans very concretely down to earth on these two problems, namely the communicable disease and access to health as a challenge, as a mission, as a focus.
Chai completes 60 years.
On this occasion of Diamond Jubilee of Chai, 60th birthday we celebrate. We are extremely happy to wish all the member institutions and all the people who are supporting this great endeavor in this country a good time and the blessings of the Almighty, so that they may serve in this same line, promoting the poor population of this country, especially in the field of health.
Today, CHAI is the largest healthcare organization in the voluntary sector of the world. Over the past 60 years, CHAI has made significant contributions in the provision of medical care and in the promotion of health of people in India, with most striking examples in the areas of health of women and children, service in remote areas and with underprivileged groups, the training of women health personnel, the promotion of public health, community organization, promotion of rational therapeutics, holistic health and the use of alternative systems. CHAI today has nearly 3,100 member institutions spread all over the country, reaching the unreached. Its members include leprosy care centers, health centers from big to small hospitals, schools of nursing, social service societies and associates serving the people of this country in urban, semi-urban, rural and tribal areas. CHAI Central Office. CHAI Central Office has been coordinating and facilitating the activities of the association with several departments and committed staff. Membership Department.
The basic strength of CHAI, or what CHAI is its membership. The membership of over 3,100 and above members who are spread all over the country, most of them in the most remote place where nobody would dare living and serving the people. Another thing is the dedication of the members. It's only the members who are giving strength to CHAI. New avenues CHAI is exploring, like alternate system of medicine, empowering women, and how to handle the alternate system by the women in the villages. And these are things that gives a credibility to CHAI, and that we are trying to indigenize our health. Also make health not only a question of cure, but health as development of the people, development of the environment and society, and a new value system.
The Membership Department documents the data of each member institution. The department also takes care of model diocesan units, supports members with scholarship for professional studies, supports community health, micro-project actions in the field of community health. The department also helps the members with legal literacy programs and updates the members with legal requirements of their institutions, government regulations, and maintains a library of law books, publications and judgments of High Court and Supreme Courts on health care. Advocacy.
In 1999, the People's Health Assembly called forth for a real advocacy role on CHAI's part, and CHAI is one of the coordination committee members at national level. It has at different level played its important role, that is national level, state level and district level. Some of our regions have really played a major role in this advocacy regarding campaign against tuberculosis, campaign against malaria, especially Ocha, Bihar, West Bengal. During the 60th year, where it is focusing on universal access to health care, CHAI feels very strongly that it has to play a major role on advocacy to create an impact in the nation towards a healthier living of every person, citizen of India, towards influencing the policies at national, state and district level.
Research. CHAI facilitated an initiative to set up an accreditation system in Bihar in order to ensure quality assurance in a viable manner and dialogue with the government for an alternative legislation. This initiative is to facilitate formation of an accreditation system in other regions and to credibly influence the government for alternative legislation to protect small hospitals and health centers in the voluntary sector. Documentation. Ever since its establishment at the central office, the library and the documentation center has been functioning as the clearinghouse of information on health and development to serve the members of CHAI. With a strong database comprising books, monographs, government reports, seminar and conference proceedings, literature relating to health and development, the documentation services add strength to the quality service of CHAI to its members. The Health Communication Group is committed to strengthen CHAI's network by organizing workshops and trainings in media and communications, equipping the members with communications, media and public relations skills, and develop the culture of interacting with other actors in their respective regions. Its production of videos and booklets on health communication are a valuable resource for health workers in the fields. Capacity building. The capacity building team has been engaged in building up a sustainable team at different levels of the organization. It also works with the congregations and the diocesan authorities in translating community health philosophy into action at the grassroots level. The capacity building team specially focuses on HIV/AIDS, perspective building, community health project planning and management, herbal and pastoral care, health communication, etc.
CHAI is able to undermine and bring out as 38 member institutions from different regions have been involved in the care of HIV/AIDS today. Especially we have about 8 member institutions in Andhra Pradesh supported by government, which is also a part of networking and collaboration in different districts of Andhra Pradesh, and also in Karnataka, where our membership have been involved, have been supported by State AIDS Society.
Networking and District Health Action Forum. CHAI has realized the importance of networking, especially in the present context of membership need. This is to support and facilitate the regional process, theme-based or issue-based.
We are happy to state that we have been successful in creating forums in all the places. In all the 23 places we have district health action forums consisting of CHAI members, government healthcare providers and leading NGO actors as well as activists in the districts. And there are all committees created and the committees are quite active in the places.
Health Action. Health Action has been a great source of information and education for not only the members of CHAI but also the others interested in health. Its contribution in shaping the knowledge of CHAI members with current information on wide variety of areas related to health has been incredible. The publications of CHAI on various health-related themes are a great source of knowledge and inspiration. They play an important role in equipping its members with new skills and strategies for health action. Problems. Like any other organization, CHAI too is not free from problems. The vastness of the association and the growing number of memberships make the communication and interaction with all the members difficult. The issue of communalism and various legislation that affect the members of the association directly are external threats. Financial constraints is yet another issue that needs attention. The association also incurred human loss in the course of its journey. To mention a few, the association owes its tribute to Sister Ansi, who served as the administrator of CHAI, and Sister Dr. Alfonza, who contributed immensely for the growth of Rupcha, one of CHAI's regional unit. The march continues. CHAI's mission towards empowering the poor and the marginalized, its fight against communicable diseases, its campaign towards the promotion of alternative systems of medicine gained more strength as it entered the third millennium.
In fact, we should look at seriously the study and the research that has been done by very committed people like Dr. Arole at Jamghat Dr. Andhia and several others in this country, where they have gone to the grassroots level, lived with them for several years, or if not decades, and have developed models that can bring health for everybody in this country. And they have developed models that are vital, sustainable, effective, replicable, affordable, and accessible. When we face the unprecedented challenge and opportunities, we seek to improve human health through education, awareness building, integration, participation, and above all, collaboration. Change is certainly crucial. We need to build up innovative systems and innovative setup. As our President Abdul Kalam said, we need ignited minds to become links of the great past to a great future. We need to realize and recognize to move away from counterproductive consumerist system that we have built up and replace it with people-based participatory model of health and healthcare facilities in this country. We should not forget the fact that the great minds of our country had the ability to make others join their endeavor to convert their dream into reality. For them, the nation was larger than themselves, and they could drive thousands to act upon their dreams. Believe we can deal with the problems that challenges us today. A change of perspective is so imperative. We know that we cannot do tomorrow's job with yesterday's tools, much less with yesterday's perspective. The challenge is to integrate and to grow instead of differentiating. And in this year of Diamond Jubilee, I'm sure that we have transcended our own limitations. We have been able to create much wider collaboration, and our network has expanded, and it has become a joint venture. Perspectives have changed, keeping the same vision, the same mission, and we strive forward with much more force, with changed perspective, but with the same vision, to bring health and healing to the marginalized and the underprivileged of this country, true to the vision of Sister Mary Glory and all those who have worked in Catholic Health Association with collaboration and cooperation. United, we move forward to bring health and healing of Christ, who came into this world with the healing ministry as his prime focus.
60 years ago, Sister Mary wrote, "I was still the only medical woman among our sisters. I felt like a solitary grain of wheat that dreams of a golden harvest." Today, we are witnesses to a multiplication of that grain. Let us continue our journey till the last person cherishes the harvest and gains control over his or her own health.